Unfortunately, children, let's say fortunately, children, they are very kind. They don't expectorate sputum. This because children don't give themselves TB.
Okay.
So the first information you need to get clear when you have a child that is sick is, has that child been in close contact, either in school, in class, at home, with grandma, with grandpa, has that child been in close contact with an adult who has cough?
Okay.
He must have been infected by an adult.
Okay, so
the prevention of tuberculosis is actually multi-sectorial. That is not only from the health angle.
okay.
The first angle starts from our housing. Because overcrowding is one of the drivers of tuberculosis. Also, there are some other determinants of TB infection, like poverty, and a major driver now is HIV infection. So those are things we need to address probably outside the health sector, that could reduce the spread of tuberculosis: overcrowding, poverty, and HIV. However, back to the specifics in the health sector. Number one prevention is BCG vaccination. There is a vaccine that is given to our children, I think at birth. At birth, BCG vaccine. This vaccine is more than 100 years old now.
We all took it.
Yes, more than 100 years old, and has been found that it prevents complicated tuberculosis in children. Note, it does not prevent TB in children, but it prevents complicated TB. There are some forms of TB that we call complicated TB, like miliary tuberculosis and meningeal tuberculosis, that is tuberculosis of the brain. When tuberculosis gets into the brain, it used to happen in children, but with BCG vaccine now, children are usually immune from these terrible forms of tuberculosis, but it doesn't stop them from having tuberculosis. So that's the way to start.
Okay.
The second one now is to look at immune system, our immune system, like diseases that suppress the immune system. What we eat, one, diabetes, people that have diabetes should get their blood sugar controlled. Then we should avoid as much as possible HIV, and for our brothers and sisters that are colleagues with HIV, they should be on treatment so that their viral load will be highly suppressed with a high level of CD4 count. And number three, to prevent TB now, is what we call TB presumptive or preventive therapy. It is very important. Now what to do is that if you have had contact with a TB patient, you are supposed to be on a drug for like 3 to 6 months that will prevent you from having tuberculosis. So those are the strategies, the ways that we use in the prevention of tuberculosis.
Okay, so thank you so much. Now, before I let you go, okay, now I want to ask the last question for today, and that is, what is one message you have for anyone out there who has TB, and for someone out there who is afraid to go for testing?
Okay, quickly, I want to first appreciate the effort of the state government on this tuberculosis control. I don't have more time to tell you how much the government has done, but they have extremely done very well. But there's an area that we really want them to do more, especially in terms of children. They have concentrated so much on the adults.
No, the children have been left out.
I want to tell you now that your state, the diagnosis of TB in adults is free. The treatment of tuberculosis in adults is free.
The children.
But among the children, the drugs are available free. But because they do not produce sputum for the diagnosis, because sputum test is free around your state. But because children do not produce sputum, we now depend on X-ray for the diagnosis. Unfortunately, X-ray is not free. So in that area, we are talking to your state government presently. They are doing so much. We have partners that are supporting this activity, but we can do more in helping children to get diagnosed for tuberculosis. And for all listeners there, check that cough. It might not be COVID-19 as you are thinking.
Yeah.
Go to the health center, it could be tuberculosis.
Okay, thank you. Thank you so much, Dr. ادينيرو. So what we have learned today is that, look, children are so vulnerable to this disease. It's not free for them. The government should please help to make sure that the treatment and testing.
The treatment is free.
It's free, okay. Is the diagnosis right now. That should please be free for the children. I hope that you've all learned a little or two on the show this evening. As well, we have one message for you this afternoon. Please check that cough. It could be tuberculosis. Thank you, ادينيرو, once again for the
Inspiration FM 100.5.